Silence in the OR. Then the screen lights up with the impossible. A knife, a whistle, a charging cable where biology says, absolutely not. The surgeon freezes. The nurse whispers, "You're kidding." And the patient mutters, "It's nothing." Tonight we're diving past clickbait into the real freak files. A live eel sparking a perforation, a nail resting inside a beating heart, chopsticks that slipped from nose to brain, and a wartime shell that made a hospital call the bomb squad. No myths, no fluff, just the snap of forceps, the burn of antiseptic, and the split second when a human team outsmarts chaos. If you think you've seen everything, buckle up. This is medicine where headlines become scars, and survival is the ultimate plot twist. Number 1. You hear the clink before you see the image. Metal on metal, inside a belly. An Indian police officer walks in with pain. He walks out with a headline, 40 knives removed from his stomach. Not toy ones. Folded steel, stacked like a dark buffet. Doctors say he'd swallowed them on purpose over weeks, chasing a compulsion he couldn't name. The scan looks unreal. Blades layered, shadows crossing. Hours in surgery, piece by piece, and a surgical tray that grows into a jagged skyline. He survives. No tidy moral, only a fragile truth. The mind can order what the body can't possibly digest. BBC reported the case, the photos burned into memory, and the quiet applause for a team that turned disaster back into a heartbeat. Number 2. A nurse says, "We need another gown." And everyone knows that's code for, "This is going to be strange." Imaging shows a live eel, about 60 centimeters, lodged in the rectum. In some write-ups, even 2 at once. Not a myth, a documented BMJ case reports nightmare with a very real risk: bowel perforation, infection, sepsis. In the room, it's all calm choreography. Clamps, irrigation, whispered timing, because panic fogs judgment, and this needs precision. The sound you can't forget is the wet hush, as anatomy finally releases what never belonged there. Surgery, antibiotics, recovery, and a warning no one wants to give out loud. The body is not a sandbox for experiments. When curiosity meets mucosa, physics wins, and medicine cleans up. Number 3. Why does he keep touching his nose? A mother asks. And then the CT scan answers with a shard of nightmare. A pair of chopsticks had slipped through a child's nose and into the brain, a freak trajectory from a fall during play. PubMed keeps the prose dry. The images do the shouting. Surgeons map the route like sappers. Avoid vessels, protect cortex, plan the exit so the cure doesn't create the catastrophe. In theater, lights burn hot, suction hums, and the room holds its breath as metal backs out of living tissue. He survives, with follow-up that measures milestones rather than inches. The lesson sneaks in gently. Kid energy plus household objects equals a lottery you never want to win. Helmets help. So does luck. Number 4. Pop. A nail gun coughs, and the worker shrugs. Just nicked me. Hours later, the New England Journal of Medicine publishes the plot twist. The nail is in the heart. Chest X-ray shows a sliver. CT shows the path. The OR shows the truth as the pericardium opens like a curtain. The choreography is steady. Bypass on standby, heparin measured, the tiniest tug guided by millimeters, and prayer. Blood beads, then stills. The nail slides free. The man lives to complain about hospital food and becomes that guy at barbecues who lifts his shirt to point where death grazed him. Moral written in sawdust and sweat. Protective gear isn't optional, and "I'm fine" is not a diagnosis. In trauma, minutes matter. Denial costs them. Number 5. A registrar whispers, You should call bomb disposal. The scan shows a war-era shell in the rectum. Not a euphemism, an actual potentially live munition, the sort that turns a routine proctology shift into a Guardian headline. The OR is cleared. The EOD team suits up. Anesthesia recalculates risk not just for the patient, but for the building. Time stretches as surgeons and sappers agree on angles, pressure, and the safest route to remove yesterday's weapon from today's anatomy. And then, anticlimax, the thunk of metal into a blast box, a scar that will be a story forever, and coffee going cold outside because nobody dared sip. Punchline with a shiver. History doesn't always stay in museums. Sometimes it checks into triage without an appointment. Number 6. Don't pull, the urologist says, because that's exactly what the teenager tried first. A USB cable has been threaded into the urethra, knotted inside the bladder like a cruel magic trick. On the ward, it's whispers and wide eyes. In urology case reports, it's anatomy, measurements, and method. Imaging confirms the loop. Gentle traction only tightens the knot. So the team pivots to endoscopy. Camera in, graspers poised. Plan B ready if the snare won't play nice. You can almost hear the hush as the knot gives and the cable snakes out, centimeter by centimeter, leaving only a pink line of regret. Why it matters. Soft tissue and hard plastic make a bad
To
contrast.
ovarian torsion,
Especially
A&E did
where
an
swelling
ultrasound which was
narrows
normal, but
exit.
obviously that doesn't
Outcome.
exclude.
Do you normally...
Successful removal. Antibiotics. A consult that speaks plainly about curiosity and harm. Punchline. If a port is for data, don't mistake your body for the socket. Number 7. A different bedside drawer, a similar idea. Someone feeds an earphone wire through the urethra, chasing sensation, and ends up in the bladder with a coiled souvenir that refuses to leave. The International Journal of Surgery case reports lays out the choreography. The human part is simpler. A face half brave, half ashamed. X-ray outlines the loop like a careless signature. Gentle maneuvers fail. Every tug tightens the noose. So the team goes transurethral, breaks the loop under direct vision, and delivers the wire in wet, slippery ribbons. The smell of antiseptic, the soft beep of monitors, the scrape of metal on metal inside a scope. Real medicine, zero judgment. Why it matters. Objects designed to flex still cut when confined. Outcome, extraction, counseling, follow-up that checks both tissue and motive. Moral. Playlists belong in your ears. The rest of you is not a headphone jack. Number 8. The scan looks like laundry left behind. Shadows that shouldn't be there. Edges that suggest fabric. Surgeons have a word for retained sponges, gossipiboma, and the World Journal of Surgery has too many of these on its pages. The stories rhyme post-op patient, fevers or fistulas, a mass that mimics tumor. Months later, a laparotomy reveals the culprit, gauze matted into a fibrous, infected ball. You smell it before you see it. The room goes quiet when the count error lands. This is why modern ORs chant checklists and tag textiles with radio-opaque threads, or RFID. Why it matters. One forgotten square of cotton can buy a year of pain. Outcome. Removal. Long antibiotics, sometimes stomas and scars that change wardrobes. Punchline. Heroes wear caps and masks. But the real cape is a checklist read out loud. Number 9. The man coughs politely for decades. He's told it's asthma, then infection, then age. Only when a bronchoscopy stares back does the twist land. A tiny Playmobil piece lodged in a lung for roughly 40 years. BMJ case reports reads like noir. Childhood aspiration, compensations built into breath, and a plastic doorway discovered at last behind scar. The tactile beats are unforgettable. The brittle click as forceps grip old toy. The plastic smell of a memory you didn't know your body kept. It comes out whole. The cough eases like a held note released. Why it matters. Kids inhale pieces. Adults inherit the mystery symptoms. Outcome: relief. A story for family dinners. And a reminder to X-ray when the puzzle won't solve. Moral: sometimes the past isn't behind you. It's stuck in your airway. Number 10. A felt tip pen shouldn't write from the stomach, but a scan and endoscopy argue otherwise. The tale in the British Journal of Radiology runs absurdly tidy. A pen accidentally swallowed 25 years earlier, presumed long gone. Now rediscovered, casing intact, ink still capable of leaving a line on gauze. The moment lands like a magic trick, black pigment against white pad. Nurses laughing because disbelief needs a valve. Extraction is careful. Protect the esophagus. Keep the cap from snagging. Bag the specimen for the inevitable photo. Why it matters. Foreign bodies can hide silently for decades and still surprise you. And yes, solvents and plastics can endure your acids longer than you think. Outcome: removal without perforation. A chart note that sounds like satire, but isn't. Punchline: if your diary lives in your gut, eventually someone will read it. Number 11. Clack. The forceps tap something that isn't food. A patient who probably swallowed a small thing turns out to have a toothbrush sitting in the stomach, bristles intact like a dare. Another case is worse. A brush migrates beyond the gut wall, sparking a liver abscess, infection brewed by plastic that refused to pass. There's no hero move here, just method. Endoscope first, loop or snare to catch the handle. Surgery if it's pierced through or anchored by scar. The small human beat is the nurse laying a kidney dish as if setting cutlery for dinner, then shaking her head at the irony. Why it matters. Long, rigid objects rarely traverse the pylorus. Delay turns curiosity into sepsis. Outcome: removal, antibiotics, and a quiet talk about impulse, choking risk, and what accidental really means. Punchline: if you can't bend it, your stomach won't either. Number 12. Any dentures? The anesthetist asks, routine as a seatbelt sign. Some people say no, then forget they ever said yes. Cases describe denture plates lodged in the esophagus for years, even close to a decade, with only vague symptoms: cough, hoarseness, food, sticking. The X-ray gives it away. A ghostly arc with little metal clasps, pretending to be part of the spine's shadow. Removal can be graceful, rigid scope, gentle rotation, or ugly if the mucosa is ulcerated and fused. The sensory detail is the scrape of acrylic against steel when the graspers finally bite. Why it matters. Hidden foreign bodies erode, bleed, and can perforate. Silent doesn't mean harmless. Outcome: plate out, ulcers treated, swallowing rehab for the timid first bites. Morale: before sleep, surgery, or celebration, count the teeth you put in and the ones you take out. Number 13. Blink and miss it. Because that's the problem. An ophthalmologist lifts a lid and finds 27 contact lenses stacked like sea glass. One patient who kept losing count. Another clinic day yields 23 in a second baffling case. The theater is absurd. Saline, cotton buds, and a soft rain of blue-green discs as a team peels them away layer by layer. How does it happen? Dry eye, poor fit, no mirror, and the belief that it fell out. It didn't. The cornea tells the truth. Redness, irritation, risk of infection. Why it matters. Vision habits scale. A tiny shortcut repeated becomes injury. Outcome: lenses removed, corneal checks, teaching on hygiene and replacement schedules that finally stick. Punchline: if your daily disposable becomes a weekly anthology, Your eyelid is the library, and it's overdue. Number 14. A single lens can hide like a coin under couch fabric. Now stretch that timeline to 28 years. A patient presents with a lump in the eyelid. Imaging hints at a cyst. Incision and surprise. A contact lens, trapped since childhood, wrapped in tissue like a time capsule. The room laughs softly, because disbelief needs a release valve, then settles into the work. Irrigate, inspect the cornea, confirm the globe is fine. The mind flickers to all the mornings that lens was declared lost, to teenage sports, to makeup wipes that skimmed right past history. Why it matters? The body will tolerate a foreigner, until it won't. Outcome: lens out, cyst resolved. A photo that looks staged but isn't. Moral: when something vanishes, check the eyelid before you rewrite physics. Number 15. Is anyone else hearing that? The patient asks, head tilted. The weird hum of a cockroach alive in the ear canal. Another day, a tick wedged in a child's ear, tiny legs anchoring like barbs. The playbook is strict. No water for roaches. They sprint deeper. Mineral oil to suffocate. Then careful extraction under magnification. For ticks, time stretches. Remove whole. Inspect the drum. Think lime, depending on geography. The room sounds like a seashell. Amplified heartbeat. Tool on speculum. The sudden hush when movement stops. Why it matters. The ear is small. The skin thin. The consequences loud. Outcome: invader out. Canal soothed. Antibiotics or follow-up if trauma won. Punchline: the night is full of noises. Some of them ask an ENT to turn off the soundtrack. Number 16. You lean over the sink, another nosebleed painting the tissue red. Weeks pass. Then an ENT peers inside and freezes. A leech, alive, attached in the nose, chart nasopharynx. Reported in the Indian Journal of Otolaryngology, these cases masquerade as stubborn bleeds and iron deficiency fatigue, especially after river swims or well water. The choreography is careful. Topical anesthetic to make it release, gentle forceps, no crushing, that triggers more bleeding, then saline, antibiotics if the mucosa's raw. The sound you remember is the soft peel as the sucker lets go. Why it matters. Living foreign bodies don't just irritate, they feed, hide, and bleed you. Outcome: parasite out, hemoglobin climbs. A new rule about what you drink in the countryside. Punchline: if your nose won't quit, and you vacationed in fresh water, think less dry climate, more uninvited guest. Number 17. A whistle in the chest that doctors kept calling asthma. Decades later, a bronchoscope reveals the punchline: a pen cap sitting in a bronchus for 26 years. Journal of Bronchology tells it straight. Youthful aspiration, chronic cough that learned to live there, and finally the camera that says, there. The team plans the retrieval like a heist. Rigid scope for control, ventilation guarded, forceps that bite the groove without shattering brittle plastic. One twist, one pull, and the room exhales with the patient. Why it matters. Long-retained airway objects mimic everything and treat as nothing. Outcome: foreign body out, wheeze fades, follow-up spirometry that finally looks boring. Morale: when symptoms outlast prescriptions, ask if the culprit isn't disease at all, but a souvenir from childhood. Number 18. Flashback. A playground tumble, a cough, then life moves on. Years later, imaging for recurrent infections shows a childhood pen cap hiding in lung parenchyma, diagnosed only in adulthood. Respiratory medicine case reports territory. Scar tissue has gripped the plastic. Removing it means a stepwise plan. Try bronchoscopic extraction. Be ready for segmental resection if granulation won't let go. Sensory snapshot. The brittle click as forceps test the edge. The hush when the cap finally slides into the barrel of the scope. Why it matters. Kids aspire objects. Adults inherit consequences labeled mystery pneumonia. Outcome: object removed or segment resected. Infections recede, and a family learns that he probably swallowed it sometimes means he inhaled it. Punchline: the past doesn't always pass. Sometimes it nests and waits. Number 19. Dentures out? The anesthetist asks. Nods all around. Midway through recovery, a rattle in the throat says otherwise. BMJ Case Reports describes the twist. A dental plate lost during anesthesia, later found in the hypopharynx, esophagus causing pain, hoarseness, or quiet obstruction. The playbook kicks in. X-ray to map the acrylic with metal clasps, rigid endoscope for a controlled extraction, airway on high alert. The tactile beat is the scratch of acrylic against steel as the graspers lock on. Why it matters. Foreign bodies in the upper airway erode, bleed, and can perforate. We think we removed it isn't documentation. Outcome: plate retrieved, mucosa treated, checklists tightened for pre-op counts and post-op confirmations. Moral: before you sleep under anesthesia, count your teeth twice, and make sure the OR counts too. Number 20. A routine CT stops everyone mid-scroll. A needle in the heart, sitting there like punctuation. No chest pain, no drama, just a serendipitous find later detailed in the Journal of Cardiothoracic Surgery. Was it migrant from soft tissue? Childhood accident? The origin stays fuzzy. The plan cannot. Cardiac surgeons weigh risks, observe if it's fibrosed in place, or go in if migration threatens chambers or coronaries. In theater, pericardium opens, a glint answers the light, and forceps lift fate by a millimeter. The monitor beeps like a metronome until it's over. Why it matters? Incidental doesn't mean ignore. In the heart, metal turns motion into danger. Outcome: successful removal or documented surveillance. Another CT scheduled. A life resumed with a stranger story. Punchline: sometimes the sharpest pain is the one you never felt. Number 21. A wheeze that sounds like a party trick. The patient swears it's just my asthma until a bronchoscope peers past the vocal cords and finds a plastic whistle lodged in a bronchus. Every exhale makes music. Every inhale drags air through a narrowed tube. Journal of Bronchology turns the spectacle into steps. Rigid scope for control, suction ready, forceps timed with breath so the whistle doesn't flip and block the airway. The room's soundtrack changes. Squeak, scrape, then the blessed silence when plastic meets tray. Why it matters. Airway foreign bodies mimic common disease and waste months on wrong inhalers. Outcome: object out, wheeze gone, lungs relearn quiet. Punchline: if your chest whistles on key, the instrument might be inside you. Number 22. Easy grab, someone says, famous last words. A pen cap jammed in a segmental bronchus looks simple on X-ray, but Case Reports in Pulmonology describes the booby traps. Granulation tissue gripping plastic like ivy. A slit that catches tool tips, a risk of pushing deeper. Strategy wins. Switch to rigid bronchoscopy for ventilation control. Rotate the cap to free the flange, then draw it out in one clean line. Details you feel: dry oxygen, metal on plastic chatter. The clamps click when it finally bites home. Why it matters. Partial obstruction breeds infections and years of misdiagnosis. Outcome: removal without tearing, antibiotics for the inflamed edge, follow-up that reads asymptomatic. Moral: in the airway, simple is what you earn, not what you start with. Number 23. Imagine swallowing and feeling nothing weird for months. A patient did, because their denture plate sat in the hypopharynx without dramatic symptoms. The laryngoscope files it under "you can't miss what you don't suspect." Vague throat discomfort, hoarseness, sometimes a foreign body sensation that comes and goes. The giveaway is imaging, a crescent of acrylic with metal clasps ghosting the midline. Removal demands choreography, rigid laryngoscope, anesthesia guarding the airway, a slow twist so the clasps don't gouge mucosa. Human note: the stunned silence when the plate hits the dish, and everyone realizes how close perforation was. Why it matters: silent lodgers erode and bleed. Outcome: plate out, mucosa treated, swallowing checked. Punchline: if your bite feels off, it might be because your teeth took a detour. Number 24. On CT, it looks like a tumor, irregular and stubborn. In the OR, the mass betrays a weave, a retained surgical sponge, a gossipoboma, masquerading as a colon cancer. World Journal of Gastroenterology catalogs the fallout: fistulas, abscesses, months of pain. The fix is unglamorous and vital: adhesiolysis, removal, debridement, antibiotics, and the post-op debrief that matters most: how the count failed, how to hard stop until numbers match, and why radio-opaque threads and RFID tracking aren't optional. Sensory beat: the sour smell when the capsule opens and the room knows the diagnosis before pathology does. Why it matters: one square of gauze can purchase a year of suffering. Outcome: recovery after resection, systems rebuilt. Moral: the sharpest tool in surgery is a checklist read aloud. Number 25. A cough that won't leave, and shadows that won't clarify. Bronchoscopy finally tells the story. A plastic cap nestled in an adult's bronchus, the kind of everyday object that slips past memory and turns into months of bronchitis. In chest, these cases hinge on technique. Align the cap so airflow doesn't rocket it distally, keep suction low to avoid collapsing the airway, rotate to break the mucosal seal, extract in one measured pull. The moment you remember is the patient's first deep, quiet breath afterward. No rattle, no fight. Why it matters: foreign bodies don't care about birthdays. Adults aspirate too. Outcome: infections fade, spirometry normalizes, cough exits the chat. Punchline: sometimes the best breathing exercise is removing the thing that's doing all the exhaling for you. Number 26. A wheeze that won't quit, inhalers that don't help, X-rays that say, maybe infection. 14 years pass. Then a bronchoscope peers into the airway, and the mystery starts whistling back. A plastic whistle, lodged so long that doctors built diagnoses around it. Annals of Thoracic Medicine turns the oddity into a lesson. Foreign bodies can masquerade as asthma, COPD, or chronic bronchitis for years if no one looks. The retrieval plan reads like a safecracker's script. Rigid scope for control, forceps that grasp without shattering, slow rotation to free granulation, one clean pull. Silence. That's the first proof of success. Why it matters: symptoms that outlive treatments deserve a camera, not another spray. Outcome: object out, cough fades, lung function normalizes. Punchline: if your chest makes music, check who's playing before you prescribe the encore. Number 27. Call EOD. The words hang in the air because, yes, there's another war-era shell in a rectum, and this time the case note reads like British black comedy. Exam pauses. The hospital's protocol unspools. A bomb disposal unit walks into an operating suite with surgeons who suddenly wish they'd chosen dermatology. Imaging maps the angle. Anesthesia plans for a zero-drama removal. The sapper and the surgeon agree on pressure, rotation, and what to do if the casing complains. Minutes stretch. Then, thunk. Metal meets containment box, and the room exhales like one person. Why it matters. Emergency medicine plans for chaos, but potentially explosive adds a new chapter on risk to staff and patient alike. Outcome: object removed, wound care, a short course of antibiotics, and a hospital memo nobody forgets. Punchline: history class doesn't cover this kind of revision. Number 28. Swallowed a cable, the chart says. Odd, because imaging doesn't show coils in the gut. It shows a loop inside the bladder. BMJ Case Reports explains the trick. A flexible charging USB cable introduced through the urethra, knotted on itself, later described by the patient as swallowed. The human part is familiar. Embarrassment, a too-late tug that tightens the knot. Medicine answers with choreography. Cystoscopy under anesthesia. A wire loop to snare and unmake the tangle. Backup plan for a small suprapubic incision if the knot refuses. The detail that lands is the quiet, when the loop finally slides free. Centimeter by patient centimeter. Why it matters. Soft tissue doesn't forgive hard edges. Delay invites infection, perforation, or strictures. Outcome: extraction, antibiotics, counseling with zero judgment. Punchline: cables charge phones. Curiosity shouldn't bill the urologist. Number 29. No choking, no drama, just a vague something there at the back of the throat that never quite goes away. Imaging answers with a ghostly crescent. A denture plate parked in the hypopharynx, somehow asymptomatic. Journal of Laryngology and Otology files it under the dangers of lost dental gear during sleep or sedation. The plan is precision. Rigid laryngoscope to own the airway, gentle rotation to free the clasps from mucosa, and slow withdrawal so a smooth exit doesn't become an emergency bleed. The sensory snapshot is the scrape of acrylic meeting steel and the little gasp when the plate lands intact in the tray. Why it matters. The quiet foreign body can be the deadliest. Pressure necrosis and perforation don't announce themselves. Outcome: removal, mucosal checks, soft diet while healing. Punchline: if you misplace your teeth, don't assume your pillow stole them. Number 30. A swallowing problem gets filed as reflux, then aging. Years later, a lateral film blinks the truth. A denture tucked in the esophagus for over a decade. Journal of Clinical Gastroenterology turns the jaw dropper into a protocol. Mark the metal clasps on X-ray, choose rigid endoscopy for strength, and be ready for open surgery if adhesions or ulceration clamp the plate in place. There's nothing glamorous about the extraction, just patient, careful turns so plastic doesn't carve a groove on its way out. The moment you remember is the first sip of water afterward that doesn't stick halfway down. Why it matters. Long-retained esophageal objects can erode into vessels, catastrophic if missed. Outcome: plate out, ulcers treated, follow-up swallow study and counseling on denture care. Punchline: the body can keep secrets. X-ray is how you make it talk. Number 31. You pinch your nose, another bleed, and chalk it up to dry air. Weeks later, an ENT peers in and goes still. A leech, alive, fixed in the nasopharynx and drinking a milliliter at a time. The backstory writes itself. River swim, well water, a camping trip where the bottle fill felt fresh. In clinic, it's choreography, not panic. Topical anesthetic so the sucker relaxes. No crushing, that turns a bleed into a gush. Then slow forceps and steady hands. The soft peel as it lets go is the longest second of your life. Hemoglobin climbs in the days after. The headaches ebb. Your pillowcase stays clean. Why it matters. Living foreign bodies don't irritate, they siphon. Stealth anemia, with a simple fix if someone looks. Outcome: parasite out. Antibiotics if mucosa's raw. A new rule about untreated water. Punchline: if your sinus season started right after a mountain swim, the problem might not be pollen. It might be hungry. Number 32. Where did that pen cap go? A parent shrugs. The child coughs for a week, then stops. Years pass. Doctors chase asthma. One day, a bronchoscope glides into a tiny airway and freezes on blue plastic, a pen cap wedged in a child's bronchus. The game plan is pediatric precision: rigid scope for control, ventilate around the tube, then time forceps with breath so the cap doesn't flip and plug the only path out. Granulation tissue clings like ivy. Rotation breaks the grip. One measured pull brings daylight. The room exhales, the wheeze retires, and the X-ray that never quite made sense finally does. Why it matters: kids don't always choke. Sometimes they aspirate and adapt. Outcome: object out. A short course of antibiotics. Follow-up spirometry that looks gloriously boring. Moral: if a cough keeps outliving prescriptions, ask if the culprit isn't disease. It's a souvenir from playtime. Number 33. Party favors shouldn't end up in pathology. A toy cap, the snap-on kind from a small gadget, vanishes during roughhousing. No drama, just a nagging cough and bronchitis on loop. Fast forward to a pediatric OR. Imaging hints at a right-sided culprit. Bronchoscopy confirms a foreign body in the bronchus. The tricks are simple, the stakes are not. Orient the cap so airflow doesn't rocket it deeper. Use a basket if forceps skate off smooth plastic, and keep suction low to avoid collapsing small airways. Then there's the click, not loud, but final, when the edge comes free and the cap slides into the scope like it was designed for that exit. Snacks taste better the same afternoon. Antibiotics mop up inflamed mucosa. The inhaler goes back in the drawer. Why it matters: common objects become stealth blockages without a choking scene. Outcome: clean removal, symptoms gone. Punchline: the best breathing exercise was removing the toy. Number 34. A child tugs at an ear and winces. The otoscope shows shadows. Magnification tells the truth. A tick latched in the ear canal, legs set like fish hooks. The room slows down, no yanking, no smearing. Mineral oil can drown some invaders, but ticks demand the full count. Grasp at the mouth parts, draw straight, inspect that nothing broke off. Geography decides the next step. Lyme risk means a call sheet of watchful waiting, or prophylaxis. Drum check for trauma. A calendar of symptoms parents actually understand. The sensory detail is tiny. The pop of release, the soft pat of forceps on metal tray. Why it matters: the ear is thin skin over bone. Inflammation here hurts now and hearing later. Outcome: intact removal, canal soothed, follow-up if fever or rash gate crash. Morale: after a woodland day, the best bedtime story is a flashlight and a look behind the oracle. Number 35. Something's moving. The sentence nobody wants to say about their own head. In the ER, an adult sits very still while a cockroach explores the ear canal, its legs turning sound into a horror soundtrack. Water will drive it deeper, so the team chooses light and oil, patience and angle. Slowly, the scuttle softens. The insect stills. Angled forceps slide along the canal wall and lift out a creature that suddenly looks much smaller under white lights. The relief is physical. You feel air again, not scratching. And also psychological, because sleep is possible once the soundtrack stops. Why it matters: the canal is a cul-de-sac with fragile skin. Panicked interventions cause more harm than bugs do. Outcome: removal, irrigation, Watch for abrasions and infection. Punchline: urban wildlife loves warm, dark spaces. Your ear is not a studio apartment. Keep it that way with screens, plugs, and a little caution at night.